How the COVID-19 vaccine will be distributed is the next challenge facing the state and the nation. I spoke with Senator Michelle Benson this week about the prioritization of the vaccine and getting kids back in school.
Distribution of the first COVID-19 vaccine is underway across the United States, including here in Minnesota. Healthcare workers and long-term care residents will be the first to receive the vaccine. As chair of the Health and Human Services Committee of the Senate, I assume you're pleased by this news.
Yes, vaccine rollout moving as quickly as it has. I mean, we're under a year from this novel virus to having vaccine being available to our healthcare workers. I think that is very good news. And Pfizer having this significant manufacturing capacity dedicated to this so that as soon as it got FDA approval, it could be rolled out. And I'm sure you've all heard about the smart crates they have that keep it at about 80 degrees below 0 centigrade in order to properly ship the vaccine, but they have sensors on it that send notice if the temperature drops. So much work has gone into this from so many quarters. And so a level of gratitude from all of us for the people who've done that, who delivered this vaccine.
Those now receiving the vaccine are on what's called the 1A list. The 1B list is other essential workers who include police, firefighters, corrections officers, transportation workers, those in food and agriculture, and teachers. Last week, you and some of your Republican House colleagues called a press conference urging that teachers be moved to the top of that 1B list. Why?
Because our elementary school students have suffered greatly, and yes, all of our students have, but in particular to safely get those children grade 5 and below back to school for their mental, physical, and emotional well-being, not to mention their academic progress. And one of the things that doesn't get talked about very much is the stress that this has put on moms. This isn't to denigrate dads in any way, but we're hearing story after story about moms who stepped back from work or quit altogether to facilitate distance learning. And so the emotional toll it's taking on families, as much as, January through May, we were all excited and board game nights and things like that. I think people are getting fatigued and they're trying to figure out how they're going to keep doing this for the long term. It's important that those students get to see their friends, and it's a way for us to start building trust. And we're not going to have kids vaccinated. The trials haven't even been completed for school-age children, but those teachers who feel they're at risk so they can safely go back to the classroom, those personnel who are in closest contact, paras, especially for special ed students who might need actual physical contact. We want to make sure that they feel safe going back to work.
Now, as you said, the vaccines are not yet approved for children, but assuming most teachers and staff receive the vaccination, then are schools essentially safe enough to reopen?
Well, there's a good amount of evidence that schools have been safe all along, especially for children age 10 and under. They have a very low transmission rate. We've seen studies from all over the world, and we're getting some data now from childcare centers and actually from private schools that indicates that's the case, that children, even if they pick it up somewhere, aren't likely to transfer it to another adult. And so that's why I think opening even before the vaccine is available would be a workable path. However, if the teachers need to feel a little more safe, and if we can get more staff in the classroom because they feel safe, then we're going to have more kids who are going to be able to safely go to school.
Now, many are talking about how the pandemic, coping with the pandemic, and the educational changes that have happened because of the pandemic are just exacerbating the disparities. So the educational disparities. So how would you like to see these vaccines rolled out for teachers? Which school districts should get first dibs?
In my opinion, it should be those schools who have been distanced the longest and have the highest disparities. And we should prioritize, obviously, staff that feel at risk within those districts. And let me say, I have heard great stories of kids who are just thriving in distance learning, and they went and got they're high school students, and they get their work done and then they go get a part-time job And there are people who are doing just great. There are people in my own family who are like, oh, I finished my work in 3 hours, so now I can go work on my hobby. That some people are handling it really well, but there are families where the kids are home alone. How can you do your schoolwork when you don't have an adult who can help you understand when you struggle with something? Children who are pre-reading, those parents have to take every single step with the child. And at least when you're a teacher, you can take the step with all of the children in the classroom and then help those who need some more support. And so, yes, distance learning works well for some. It doesn't work well for others, but we have been identified as a state with huge disparities, and we know that's getting worse. The significant number of children in the St. Paul School District who are receiving failing grades. The failing grade isn't about shaming, it's that they're not ready to move to the next step. If they're not ready to move to the next step, let's help them get there as fast as we can.
In the press conference, you said that teachers and staff would not be required to be vaccinated, that it would be voluntary. However, I did read in the AARP that employers do have a right to compel employees to receive a vaccination. Can a school district compel their teachers to do this?
We don't mandate vaccines, and so I know that there can be restrictions. For example, nurses who don't get the flu shot can be required to wear extra protective equipment or be restricted as to what patients they work on. And so I take medical procedures and medical decisions very seriously, and I think it should be based on informed consent, and it should be voluntary. And let's work on building trust instead of compelling people. The idea that in order to go to work, you have to take a shot in your arm that you don't understand or that you're not comfortable with seems antithetical to some pretty basic trust that needs to be built between an employer and employee.
Finally, in terms of the general population, how concerned are you about the issue of vaccine hesitancy? Are there enough Minnesotans willing to be vaccinated to bring the pandemic to a close as soon as possible? Or is, the effects of the pandemic, may they go on longer simply because there aren't enough people willing to get the vaccine?
Well, we'll get some herd immunity from people having been exposed, and the Department of Health hasn't really focused on herd immunity through exposure, but it will happen. And there's a threshold below herd immunity where the virus movement really slows down. I don't know what that threshold is for this virus, but it could be as low as 20%. Some have speculated 20%. But the hesitancy, we know that there are ethnic communities who have an inherent mistrust of the government wanting to vaccinate them. If you recall the Tuskegee experiments, that is a lingering mistrust. There are people in Native communities who don't trust. And so we need to be really cautious about shaming. The Somali community doesn't have a high compliance level with the measles vaccine because of the rumors of autism-related impacts. And so let's work on, again, building that trust. Those who want it, great, go get it, but don't condemn your neighbors because they're a little bit more cautious. And it's interesting, I just started reading a report about what happens if you get this vaccine and you already have immunity. And so we need to dig a little bit more deeply into that. I'm not sure that we need to spend vaccine on people who already have some level of immunity until, I think this is going to be sort of a seasonal shot. Maybe we need another round next year. So there's a lot to be said there. And I'll try to be concise. There are levels of impact before full-on herd immunity. That doesn't mean we don't keep working towards herd immunity, but that can happen through community exposure or vaccines. And we need to be respectful that historically there are communities that don't trust what they're being told about healthcare.
Senator Michelle Benson, I want to thank you for your time.
Glad to be here. Thank you.